first, I have to start to say what is cystinosis. So it's a condition that is characterized by the accumulation of the amino acid cysteine in the lysosome of all the cells in the body. So cystinosis, the symptoms start in infancy with a renal Fanconi syndrome, which is a decrease of reabsorption of minerals, nutrients, salt, fluids, and a poor growth and rickets of a kid. Then the kidney damage continue and evolve to end-stage renal failure, requiring kidney transplantation. But the buildup of the cystine crystals, because the cystine, when the cystine accumulated, it creates these very characteristic crystals in all the tissues. And obviously, this is not damaging all the cells and the tissues. So this happens in all the organs. So then the patient also develop photophobia with a buildup of cystine in the cornea and eventually blindness if it's not treated. They also develop muscle weakness, leading to decreased ability to breathe and sometimes fatal aspiration. They also develop neurological defect. So to treat all these symptoms, it's very difficult. And first you have all the symptoms. So they have to take pills to compensate the loss of nutrients. They have to take growth hormones, etc. But you also have the cysteamine, which is a cystine depleting therapy. So it allow to the exit of a cystine out of the lysosome. So this decreases the buildup of cystine into all the tissues. But the issue with this treatment is that it only delays the progression of a disease, doesn't stop it. It's also associated with a lot of side effects that are mostly gastric side effect with vomiting, nausea, diarrhea. And the patient also have this sulfur odor, so they really smell bad, which is an issue for the kids and adolescents, for their compliance to the treatment. And also we have to take 40 to 60 pills a day, even the kids. So they have to take pills around the clock every day, and sometimes including at night. Plus, to prevent the buildup of cystine in the cornea, they also have to put every hour cysteamine eye drop. So it's a very demanding treatment for cystinosis. And again, it doesn't stop the progression of a disease, it delays it. And so the patient also still require kidney transplantation also. And they eventually die from the disease in adulthood. The principle of CTNS-RD-04 is that it was first to do gene therapy to try to prevent or to stop, all the consequences of cystinosis altogether. The issue with cystinosis is that the gene involved is expressed in every single tissue, so it's very complicated to provide a healthy gene to all the organs. But also, it's a non-secreted protein. So the CTNS encode cystinosin, which is a transmembrane lysosomal protein that allows the exit of cystine out of the lysosome. So it is very complicated to do a gene therapy in this context. So we used the hematopoietic stem cells as a vehicle to be able to bring the healthy protein and healthy gene in all the organs, because the beauty of the hematopoietic stem cells is that when they reconstitute the bone marrow, they reside into the bone marrow for the life of the patient, and they can migrate to the injured tissue where they can differentiate in macrophages and provide the healthy protein to the adjacent disease cells. So this is what this was the principle of doing all this technology for cystinosis, and we did all the preclinical studies showing that one-time bone marrow transplantation of gene-modified hematopoietic stem cells using a lentivirus vector containing the healthy copy of a CTNS gene was able to stop the progression of the disease and lead to the decrease of cystine in all the tissue of the mice. So this is the principle. So we have started the phase 1/2 trial in July 2019 after we received the FDA approval. We transplanted the first patient in October 2019. Now, the first patient is more than a year post-transplantation, and our targeted number of patients that we want to enroll is 6 patients. And so far, we have treated 3 patients. So the 3 patients are 3 males, including their age are included between 20 and 46 years old. They have received, the cell product with a one-time infusion after a myeloablation using busulfan. So the dose for the busulfan chemotherapy is 90, and we do one-time infusion after that. What we have seen so far is that we obtain a decrease of the cystine content in the white blood cells of the 3 patients. And in patient 1, where we have the most data, we have seen that there is a decrease of the cystine crystals into the cornea of a patient, into the skin, and into the intestinal mucosa. There is also an improvement of photophobia in patient 1. And we also seen cystine crystals build up decrease into the patient 3. Unfortunately, because of COVID, the data are kind of not following the perfect timeline that we put together with a clinical protocol because the patients were not able to come back for a while. So, but now, they are coming back again. So we will accumulate more data. But yeah, so far the data are promising. We have a clear decrease of cystine crystals and into the tissues.